India is sitting on a ticking time bomb, and it's not the one you'd expect as the country races ahead. Economically, it is quietly aging. But are we even ready for the grey wave? India is witnessing a silent but alarming elderly crisis, and the numbers are staggering. Over 14 crore Indians are now above 60. That's over 10% of the population. And guess what? By 2050, this number is expected to double to nearly 35 crores elderly citizens, from 10% to 20%. But you know what the problem is? Of the lot, only 29% of them receive pensions. What do you do when you don't have pensions? You are dependent. What it means is that more than 70% of India's elderly are staring at a future without any kind of a financial security. We all know that traditional family support systems have collapsed, especially in urban India. We are all now nuclear families. Many senior citizens are being left to fend for themselves with little income, no care, and so far as respect is concerned, it does not exist. You are old, some people feel, and therefore you are a burden. The report titled India's Aging Society, the Landscape Today paints a bleak picture. Released by GiveGrants India, it draws on data from the India Aging Report 2023, Niti Aayog and the Ministry of Statistics. The findings are a wake-up call for all of us. Nearly half of all elderly suffer from hypertension, 43% live with diabetes, and over one-third battle with arthritis. Yet India has just 270 trained geriatricians to treat more than 14 crore older adults. There's one specialist for every 5 lakh seniors. What about palliative care? Out of reach for most. Insurance schemes like PMJ only cover 1 in 4 seniors, and many of them don't even know about it. While aging can be hard for many people, it's hardest for women. They live longer but suffer more. 71% of elder abuse victims are women. Add to that the digital divide, 59% of seniors lacking access to smartphones or internet. Isolation grows. They are feeling lonely, alone and helpless. India has just 1,000 old age homes, mostly urban. Many are substandard, but there are very, very big luxury homes. But then who can afford it? Maybe 1%. But for the rest, well, you are, like they say in Hindi, Bhagwan Bharose, only God can save you. This is not just a demographic shift, it's a social emergency in slow motion. The question is, who will care for India's forgotten generation? Is this no country for older people, a country which touches the feet of the elders but then abandons them once they are not able to fend for themselves? What hypocrisy, what a dichotomy. Dr. T.V. Shekhar, Senior Professor of IIPS in Mumbai, has joined us, and we shall also be joined by one more guest. Dr. Shekhar, thank you for making the time. What alarming statistics are these? Only 29% receive pensions? You know, and also it's 10% of the total population. I see that South, the figures are huge when compared to North Indian cities. Topping the charts is Karnataka, Kerala, both at even keel, Tamil Nadu, Andhra, Telangana. You know, do you see, Dr. Shekhar, this as a time bomb ticking in slow motion? Because there are lots of repercussions to be had because of elderly aging population.
Uh, yes, you have very right uh, presented a very serious
Shekhar,
issue.
I'm getting echo in your audio, sir. You want to disconnect for a moment and connect back? Those are the screen. I mean, Dr. Shekhar will connect back. Meanwhile, you can see the statistics. Let me tell you, only 29% of senior citizens get pensions. Most of them don't get any palliative care. Most of them are abandoned. And the thing is, the government schemes, PMJAY, that also does not penetrate enough and is not accessible for most people. What about Digital India? It doesn't exist for those who are elderly because they have no access to either smartphones, and many of them don't even understand it. Particularly vulnerable are women because they do live longer than men, but then they are the most abused. The story we are talking about today can happen to all of us. No one can escape aging. If you are born, most of us do age, and this is a story which has an universal appeal. Dr. T.V. Shekhar, who is a senior professor from IIPS in Mumbai, is joining us in a moment, and Dr. Proshun Chatterjee, Chief of Geriatric Medicine and Longevity Science, Artemis Hospital. All right, to join more on what really the crisis is, we'll be joined by Dr. T.V. Shekhar, who's senior professor at IIPS Mumbai. He shall throw light on what is the way out if 29% of the elderly population, which happens to be 10%, get pension. So, Dr. T.V. Shekhar, welcome back, one would say. Tell me, what is the solution? Why is this a very big crisis? What kind of repercussions will it have in the future? Dr. Shekhar.
Uh, you have broadly highlighted the serious nature of India's aging crisis and the rapidly growing elderly population in our country. There is a substantial increase going to happen in the total elderly population. By 2050, around 20% of India's citizens will be the senior citizens. That means 1 in every 5 individuals will be an elderly in India by 2050. And for southern India, southern Indian states, it will be even much before that by 2036. So this is an alarming number of elderly in our country, around 340 million elderly by 2050. The question what you are raising is, are we prepared enough to face the challenges of providing economic support, social security, health care, and many others support required the fastest or rapidly growing elderly population in India. Though there are many efforts by the governments, both the national at the state level, we need much more need to be done, because based on our own survey, the longitudinal aging study in India, LASI survey, which shows that around 1/3 of poor elderly are receiving old age pension. That means much more need to be provided that support, and the old age pension is a very small meager amount of, it varies from state to states. Rupees 400 in some states, rupees 3,000 in some other states. This is a monthly pension given to the elderly belong to the BPL households. And there are good number, around 1/5 of the elderly widows are also getting the widow pension. So the support given to the older population is much, much less. The demand is much higher.
No, tell me, Dr. Shekhar, before we go further, you know, there was a time when we heard that people died when they were 50 of consumption, which is tuberculosis or other disease. This longevity, particularly when we see in South, like Kerala or Karnataka, is it because of good health care? That's why longevity has increased. Would we say that is the good news first, that we are all living longer because we have better medical facilities, Dr. Shekhar?
Surely. Our health services are improved considerably, naturally will show. But the question again is important. Are we going to live more years, or are we going to live in a healthier life for more years? That is more important here.
Right. Dr. Shekhar, I also want to bring to your notice about only 29% getting pension. You say there is poor pension which is given both to the widows and those who are holding BPL cards. I'm talking about scores of others who get neither. They are abused, they have no kind of support systems, and also look at the care given. You see government run old age homes, they are pathetic. I have seen some of them. They are dirty, where the elderly are kicked around, some of them, not all. If you go to the very rich kind of old age homes, which are, a lot of them are there in particularly Coimbatore, I've seen many and I've visited many. They are all 5-star, which you have to deposit lakhs and lakhs to stay there. You have a swimming pool. I do not know what the elderly do, but it's their choice. You have, billiards, you have all kinds of clubs and games, but only 1% can afford it. So look at it this way, Dr. Shekhar. Even hospitals, government hospitals, if I am 75 years old, I have to go and sit there. I will maybe, pass away there because my chance will only come after a month. I cannot afford the private hospitals because they are so expensive that I'll have to sell myself. What is the way out, Dr. Shekhar? It looks like darkness all around. And this is a country which talks about, oh, Mata, Pita, Devo, Bhava, elders, touch their feet, all that. I think it's a lot of hypocrisy, Dr. Shekhar.
I think the issue here is uh, we cannot afford or we cannot think of as elder care based on the Western model. The Western model is the institutional care, old
Right.
age homes. We have a large number of elderly, so we need to think about Indian model of elderly care that is, should be fully based on families. Even now, if you look around and our own data shows that 95% of elderly in India are living with their families, with their children, grandchildren. So basically the care and support and emotional, everything has to support, everything need to come from the families rather than old age homes. And even if you are telling only 1,000 old age homes, it's a very, very minuscule number of elderly are living in old age homes. So basically what we need to think about a family-based elder care and support, and families need to encourage the children need to be encouraged to allow their elderly parents or grandparents to stay with them and to take care of them. Now, as far as healthcare is concerned, it is a major issue. As you rightly said, large number of them are suffering from chronic diseases, whether it is diabetes, hypertension, bone and joint disease, cardiological issues, and all other things. And according to some of the surveys, only 20% of elderly are covered by any health insurance schemes or any other health insurance. But recently, the government of India came out with an important announcement that all elderly above 70
Yes,
years,
I know, but even
irrespective
that,
of their income,
yo, but Dr.
irrespective of their
Shekhar,
income,
but Dr.
yeah.
Shekhar, even there, the research shows that it's not accessible. It's only reaching a few people. Now, what are the reasons? It's for authorities to look at. Dr. Shekhar, the other danger of, I'm calling it a danger, all the elderly, please pardon me, the other danger of it is, if you have such an aging population, and look at Muka Stalin, Chief Minister of Tamil Nadu, or Chandrababu Naidu of Andhra Pradesh, they want people to have more children. The reason being, after delimitation, the seats will come down for both these southern states. Am I right? Now you need to have more children. The other fallout, if the aging population has increased because of good health care, which we have discussed, what happens to the workforce, Dr. Shekhar? The young people's workforce who can work in factories, who can work in offices, that is also shrinking. Fertility is also shrunk. So overall, a state or a kind of a community is facing huge danger for the future, Dr. Shekhar.
Yes, this is a very significant demographic shift. It is not only the elderly number is increasing, they are living more years, but the fertility has come down drastically, particularly in the southern states. And the old age dependency is going to increase because we are going to have more and more elderly persons living more years. Depending on the younger generation, their number is coming down for their work, economic support. So there are many issues, many challenges before us. But as a country, we can also think about various schemes, various programs, family-based elder care systems, better health insurance policies, more geriatric hospitals and specializations, and many other things. And so it is a big challenge, but as a country, as a nation, we need to face it. And many state governments have come out with their own state level elderly policies. Kerala is a good example of providing various services. So it is a big challenge and we need to face it. And there is no easy solution to all these kind of problems.
The thing is, when you say demographic shifts, we also should talk about the shift which has happened in families. There was a time when I lived with my grandparents and my great-grandmother was also there. Children were taken care of and so were the elderly. Don't you think that the problem, although you say that a lot of elders are living with their parents, with their children or grandchildren, don't you think the nuclear family, When we became nuclear family, that also posed a big challenge for the elderly, because with me working and my husband working, we are hardly home. Who takes care of the elderly? If that elderly requires even, kind of food to be served in bed, who's there to do it, Dr. Shekhar?
Yeah, this is a major social shift that has happened not only in urban India, but even in the villages now.
Right.
Large number of there is a gradual disintegration of joint family system. It happens because of modernization, mobility of people moving out for job opportunities, education, and also attitudinal changes. Many younger generation, many young
Anita
people
Ramesh.
prefer to live separately away from their parents or grandparents. So there are many changes happening, and good number of them migrate out of the state or out of the country, and they are not in a position leaving behind their elderly parents. So this is a big challenge, and with the increasing number of years or the life expectancy, you can expect more disability issues. People are not able to manage their own, more health issues. So all these are bigger challenges and bigger issues. And some of the schemes of the government, for example, Ministry of Health and Family Welfare, Government of India formed a scheme called National Program for Health Care of Elderly. They are trying to implement a certain geriatric specialized care in specialized institutions, training more geriatricians, providing more geriatric wards in the district and medical colleges. There are many efforts going
Yeah,
on,
but
but
then
the
as
country,
of
the
today, the situation looks grim. It looks dark. Dr. Proshun Chatterjee, Chief Geriatric Medicine and Longevity Science, Artemis Hospital, is also joining us on the phone line. Dr. Chatterjee, I want to ask you, there are apparently only 270 trained geriatricians in the country. So far as government hospitals are concerned, the situation is not looking good. So far as private hospitals are concerned, many of the elderly can't even afford it, because these hospitals are run like five-star hotels, and you can't afford them. Where do the elderly go? Why is it geriatrics is not given more attention than what is required? Because the elderly population in this country, Dr. Chatterjee, is increasing by the day, and particularly in South Indian states of, let's say, Karnataka and Kerala. Dr. Chatterjee.
Yeah, thanks for having me in your studio. I would like to stress here that uh, the stress is 80 plus is the fastest growing population, not 60 plus. And 80 plus means there are some form of disease, disability, compromise in quality of life, cognitive impairment. All these are add-on problems. So definitely, it is a valid question that how are you going to solve the problem? But
All right, Dr. Chatterjee's audio created some problem. He said, well, more problems are for those who are 80 plus. I wanted to ask Dr. Prasun Chatterjee very humbly that unless you are 60 years old, you can't get to be 80. So the crisis starts at 60. Anyway, let's see if we can get him back. Dr. Shekhar, I'm coming back to you to ask that, women are very vulnerable. It's showing that they live longer than men. It's been proven. But then the point is, they face more of what is called abuse, of being beaten up, of being isolated, of not being given food, of being told that they are useless, because as such there is a general perception that once you are not in the reproductive age, you pretty much become, if you can't cook, then what use are you? I mean, most women in many families are treated like she is useless. Dr. Shekhar, tell me about the vulnerability of the elderly amongst the female population, sir.
yeah. Uh, in Indian case, around 55% of elderly women are widows. Whereas if you take the elderly men, it is only 16%. So there is a considerable feminization of aging. Large number of elderly women, particularly elderly widows, and their life expectancy is much higher than compared to the men. So this has many implications. One is that they don't have their partner or husband's support to them. They are fully dependent on their children. Second thing, most of these women have no regular income, no property, and no, not even pension. So that will make them more vulnerable. Good number of them are belong to the poor families. So they are aged, they are widowed, they are poor. So there are multiple levels of vulnerability of these elderly women face. So this is a big challenge, and this is one particular segment needs more attention in our policies and programs.
All right. Okay.
Even we talk about elderly as such, but the elderly widowed women need more attention, more focus, considering their vulnerability.
All right. Dr. Anita Ramesh, who's Professor of Medical Oncology and Senior Consultant Medical Oncologist, has also joined us. Thank you so much, Dr. Ramesh, for joining us. Dr. Ramesh, we are talking about how the aging population has increased in India. And of course, it's particularly increased in southern states like Karnataka, Kerala, even Tamil Nadu, even Andhra Pradesh and Telangana. There are northern cities as well, but south seems to be topping this. But there is no care or empathy. I'm talking about medical care and empathy. Dr. Ramesh, there seems to be a big challenge because geriatricians trained are only 270 people for, let us say, every 1,000 or 1,500 in this country. Government hospitals are really not well equipped, and private hospitals charge you too much. Why is it that, much like oncology, a subject that you're an expert in and which also requires a lot of money if you have to get cured, geriatrics is not given enough attention in this country? Dr. Ramesh.
Yes, you are right. A very good evening for the discussion. Geriatric is a newly developing branch in India. Frankly, to speak, most of the hospitals don't have. We even don't have a proper course like MD, which we have for pediatrics and other subjects. So it's in this very native or early stages of development. Most of the hospitals do not have a geriatric branch. The general physicians are treating these disorders. So yes, where do they go? And it's a rising problem. And if you have the Globocon data, the longevity of Indian population has shifted from around 5.9 to 69.9. It's almost 70. So almost the median population is going to be living up to the age of 70 as on today. Okay. So with this, yes, definitely we'll have huge burden of patients who are in the 70s, 80s, and all the cardiovascular, neurological, cancer, any problem you say, all the chronic disorders. And these chronic disorders are not curable. They can be only controlled, and over a period of time they progress. So huge amount of health burden. And I think government and all of us now should be geared up to have a separate department of geriatrics, special training. They should be also included in the government scheme. Insurance is another important thing, because some people are not taken into insurance if you're age above 70. Okay, and then 80, 90, those who are reaching 100 do not have insurance because none of the private companies are willing to take them up. And that's a huge burden. You're right. The treatment also of these disorders, not only in the government as well as in the private sector, is exorbitantly, because they're all very complicated treatment, because each patient has multiple comorbidities. So healthcare cost is increasing. And so it's definitely a big burden, and government needs to really think how to plan, put into insurance, have separate departments, special training, both in the government and the private sector, and manage these things. And one more important thing I want to say, the drug cost is very high. The diabetes, the hypertension, then the nephrology, kidney transplant, cancer. And once this patient is a lifelong drug, it's not that I'm going to stop in 6 months' time. So whether the government scheme, that is the Pradhan Mantri scheme, can give these chronic medicines so that it will relieve them from buying such exorbitantly costly medicines. So it's a multifactorial healthcare problem. I think good you brought it for discussion, and we really need to think about it, how to go about.